You've learned some basics that can often start to alleviate your symptoms. Those level 1 exercises are still staples of neck-related nerve pain and should always be a part of your routine. But how do we progress to further reduce symptoms and prevent them from coming back? The goal in level 2 is now continuing strengthening your neck and scapular muscles while also improving your mobility and stability. As always, refer to your handouts for illustrations and step-by-step guidance. Consult your universal guide to safe exercise if anything is unclear. These level 2 exercises should be completed 2 to 3 days a week, in addition to continuing your level 1 exercises daily. Let's go over a seated chin tuck. Chin tucks are a progression. Level 1, we start lying down with our head resting on a pillow. Level 2, we're going to move into an upright position, so sitting or standing. And it's the same exact exercise. You're going to tuck your chin down, hold for 5 seconds, and repeat. So 1, 2, 3, 4, 5, and then relax. So on and so forth. You're going to repeat 20 repetitions, and this can now replace your level 1 chin tuck. And you can do this daily in the program that you're creating here. Let's go over rows. Rows are a great exercise to strengthen our mid and low trap muscles on our back and help improve our posture. By improving our posture, we can reduce the strain on irritated nerve roots in our neck. To do a row, I'm always going to start with the lightest band and gradually work my way up. I'm going to hold with my palms facing me. I'm going to pull back towards me, shoulder blades squeezed together, and then back. Big things with rows is try not to shrug your shoulders. You want your shoulders to stay down so you're engaging the right muscles, and you're not pulling towards your pockets with this one. You're trying to keep your forearms parallel to the ground. So 1, 2, 3, so on and so forth. You're going to complete 20 repetitions, and you can do this 2 to 3 days a week in the program that you're creating here. If you don't have a setup like this at home, that's okay. I tell patients all the time, you can just use a regular band, tie a knot, and then just close the knot in any door at home. And now you can do your rows with just a regular old band. Let's go over band extensions. This is just a different way that we can strengthen our mid and low traps at home to help improve our posture line and reduce the stress on irritated nerve roots in our neck. To do an extension, you're going to take a band. Your palms are going to start towards the floor with this one, and you're just coming down to your pockets, and then back to starting position. Down to your pockets, back to starting position. Just like with the rows, you're avoiding shrugging, so keep those shoulders down so you're engaging the right muscles, and back to start position. You're going to repeat 20 repetitions, and you can complete this 2 to 3 days a week in the program that you're creating here. Let's go over wing arms or external rotation. This is another exercise we can do at home to improve our posture line, which helps reduce irritation on nerve roots in our neck. You're going to bend your elbows to 90 degrees. You're going to hold the band with your palms facing towards the ceiling. You're going to grab the band, elbows stay at the sides, and then you're just going to pull apart, pull apart, pull apart. Each one is 1, and you're going to shoot for 20 repetitions. Common mistakes with this one is keeping your elbows off your body or pulling down too low. So keep that 90-degree angle, elbows at your side, and then just pull apart. You're going to repeat 20 repetitions, and you can do this 2 to 3 days a week in the program that you're creating here. The next exercise we'll go over is called horizontal abduction or reverse flies. You're going to take a band that you have at home, you're going to grip it on top, arms go straight, and you're going to flip your thumbs so they're facing the ceiling, and you're just going to pull apart until the band reaches your chest. Pull apart, pull apart, pull apart. This is another exercise to help improve our posture line to reduce the strain and irritation on nerve roots in the neck. A couple common mistakes with this one is, again, shrugging your shoulders or pulling it too low. So keep it nice and square, shoulders stay down, and you're just going to pull apart to your chest. You're going to repeat 20 repetitions, and you can do that 2 to 3 days a week in the program that you're creating here. The next exercise we'll go over is progressing our controlled movements from level 1. In level 1, you're either moving up to the middle or down to the middle. In level 2, we're going to start to work into the opposite direction, assuming symptoms are starting to calm down. So if in level 1, you were moving up and looking down felt not so great, in level 2, we're going to start to move down into a pain-free range. I don't want you moving into pain that's higher than a 3 out of 10, but I want you to start to work into a comfortable range. So you're going to look down and then back to the middle. You're going to repeat that 20 repetitions. If you were the opposite and looking up hurt in level 1, I want you to start to work up in a pain-free range that's less than a 3 out of 10. You're going to find what's comfortable for you, and you're going to look up and then back to the middle. You're going to repeat 20 repetitions. We're also going to start to incorporate some rotation motions now. So if your symptoms are on the right side, I want you to start to look towards the right and then back to the middle. I want it in a range that's less than a 3 out of 10 on the pain scale. So looking to the right, back to the middle. You're going to repeat 20 repetitions, and you can repeat this 2 to 3 days a week in the program that you're creating here. The next exercises we'll discuss are called Cervical Isometrics. These are great exercises we can use to start to turn on our neck muscles to help strengthen them and also potentially help alleviate some pain. We're going to start with a rotation isometric. To do a rotation isometric, it's as if you were looking towards the right and you're going to push into your own hand with about 25 to 50% of your maximal force. You're going to hold 10 seconds and then relax. Push, hold 10 seconds, and relax. You're going to repeat 15 repetitions of this. The next one we'll do is a side bend isometric. So instead of going like this, you're going to side bend into your own hand with about 25 to 50% of your maximal force, 10-second hold, and then relax. And repeat, 10-second hold, and then relax. You're going to repeat 15 repetitions of that one as well. You can repeat these 2 to 3 days a week in the program that you're creating here.